anti-reflux surgery now.
Yes. Anti-reflux surgery is done to treat this acid reflux. Now, what does acid reflux means? We have this food pipe in our chest area, then in the tummy comes our stomach, which stores the food. Then eventually that food passes into the intestines. Now, junction between our food pipe and stomach, it has a valve which is tight and prevents the food and acid to come back up. Due to our modern lifestyle, our dietary habits, we do some silly things like eating a lot of fried food, drinking soda, alcohol, smoking, chocolates, spicy foods. This will make that valve loose. When that valve is loose, it lets the food and acid to come back up. So when the food and acid comes back up, you feel those heartburns. If it comes to your throat, you may feel throat irritation. Sometimes you get some cough. If it comes to your mouth, you get bitter or sourness in your mouth. It may have some atypical symptoms like having asthma-like symptoms for a very long time. So it affects your quality of life. And there is a slight increase in cancer risk because of continuous exposure of acid to your food pipe. Not too much, but a bit. So it needs treatment. So treatment entails diet first, because it happens because of your diet. So you need to cut down on smoking, alcohol, sodas, fried food, spicy food, coffees, chocolates. Even after doing diet changes, if it doesn't help, there are those medicines which reduces acidity, which increases stomach motility so that food passes into the intestines faster. There are a significant number of people who do not benefit from diet or even the medicines. In those patients, they need surgery. We need to make that valve tight. So usually we wrap their own stomach around the food pipe and make it tight. So
use their own stomach?
Yeah, patient's own stomach. Stomach is a stretchable organ. So the stretching part, we wrap it around the food pipe. It's called a fundoplication. But that makes the valve tight and it prevents the food and acid to come back up. Again, with laparoscopy, so no big cut. So it's a pretty much safe surgery.
What's the post-surgery care for this?
Post-surgery, when we make their food pipe tight, initially it is more tight because it was loose and suddenly it's tight.
Yeah.
So there is a significant difference for yourself. So you may not be able to take solid foods immediately after surgery. So we need to start with liquids first diet. As you tolerate liquids well, we add some soft diet like mashed potatoes, rice, something like that. As you tolerate it better, you go on to other hard stuff. For meat and all, we first start with fish because it's the softest form of meat. Then you go for chicken and steaks, and those things will be the last thing. So we gradually progress as you tolerate it.